They didn't like the chin straps. They didn't like the full face masks. I would recommend mouth taping with a smaller nasal mask, or just the nasal, I forget what they're called, the apertures, just a very minimal mask. And that was working well. And then I started telling everyone, if you have cavities or gum disease, you should be mouth taping. So it kept going from a sleep airway kind of need to oral health need. And now I think, given that you're the right patient and you can breathe through your nose, everyone should be mouth taping. And my only question there is, from an evolutionary standpoint, why does a healthy person sleep and why does their mouth fall open? Did our ancestors do that? I don't know. I don't know the answer to that. Is it because we're sleeping on a modern mattress? Is it because our CO2 levels in our rooms are elevated? I think that's a possibility. Open those windows, keep your CO2 at 450 parts per million. We have meters in most rooms in the house. I travel with one. I was just in LA in a hotel room. Oh my God, horrible. Bloodshot eyes in the morning, 15, 1600 parts per million of CO2. It's really a hostile environment out there, and our ancestors slept outside. When I go backpacking above tree line, even though it's at high altitude at 10,000 feet, my wife and I sleep so well, even though we're a little anxious because we try not to get into the tent. We're out in the open, we're above tree line, the stars are out, you can read a book just from the light from the Milky Way, no moon. It's kind of a little nerve-wracking, but then when we fall asleep, we wake up refreshed. We have amnesic sleep. That's my number one. That's one of the things I ask patients um, as I'm treating them for sleep. Typically, when you toss and turn, it's a long night because you're conscious, you're awake. Uh, but amnesic sleep, I always, and it's in my book. If you wake up in the morning and you don't open your eyes necessarily, or if you have a mask on, or it's still dark outside and you think, oh, it's probably 1 a.m., but it's actually 6 a.m., that's a good sign. That means you hit deep stages of sleep, REM, delta wave sleep, and all that. So I don't know. It's mouth taping is something that we need to really get serious about
Yeah,
because of
I
our
think so
deficient
too.
faces. Yeah.
In terms of, in order for this to become mainstream, and I think it should be,
Hmm?
I'd see no reason not. But you made a very good point. You first determined that your patient is able to breathe in and out through the nose.
Right.
We use that taping test with children. We also have them then, but we do the nose and blocking exercise, we do the steps exercise, and then we have them walking and running with the mouth closed. Because
Hmm.
if I'll watch their breathing not just during rest but also during exercise, just to see if that child, how well can they cope with physical exercise with the mouth closed, and if they
Hmm.
can do that, I'm comfortable that their nose is working.
Right.
You said that TikTok isn't necessarily helping. I don't know. In some ways, I think it is. It's putting it out there, but in other ways, it's simplifying it. You can't just slap on tape across the mouth because
Mhm.
if you have somebody with obstructive sleep apnea and if they're mouth puffing, they need to be able to mouth puff.
Right.
What's your kind of take on that aspect of it? Since you touched on the social media, good or
Yeah.
bad?
Um, I just worry. I'm not worried about someone passing away in the middle of the night, even if they vomit in the middle of the night. And again, I may be wrong in this, but there are no known cases of someone dying from mouth taping. The drive to breathe is so strong, and the tape is so weak. Now, if you're using like a gag or a duct tape, I mean, it could go wrong. But all the mouth tape I've used, and I've tested a lot of mouth tape. Um, and certainly you could use, myotape, right? Because there's no chance. You can part your lips if you want. It's a reminder to keep the mouth closed. There are a lot of options, but I'm not worried about the health aspects of it. I'm just worried about the misinformation. So a lot of people will mouth tape, and I talked about this earlier. There are a lot of patients that can't mouth tape, and they're like, "Ah, didn't work for me." Well, they don't understand why it didn't work for them, and the pity there, the sad story there is that that was a great bit of information that they missed or their provider missed. And it means that you cannot breathe through your nose. So let's fix that. And that's what the message should be. If you can mouth tape through the night, you're a healthy person.